thanks for popping by on the internet and attending in person. This is the first of our All About Dogs events, which we'll be having once a month out here at the ranch. There'll be clinics on all sorts of things, from working with your dog off leash on trails to doggy first aid, which is what we're doing today. Alice is heading up the program, and so she'll be a familiar face out here. She's got a lot of experience doing fun stuff with dogs, including dog sledding, all sorts of fun activities, and she's also working at It Happens with Sarah and I. So get used to her face. It's a good one. She'll be putting on some cool stuff for us. She's going to introduce the event today, and I'm going to let her take over, and I'll be running the cams and chat. So if you have any questions, run them by me. Thanks.
All right, so first up today, we have a presentation by Jewel Willis. This is Jewel. And she has been doing this pet first aid education and been a part of the Pet Professional Guild for about 2 years now. And she's the owner and operator of The Joyful Animal. And we're very excited to have her today, and she's going to go over as fast as she can, as much information as she can. And this is all really important information, not only for your own dog, but if you know anybody with dogs, if you plan on having your own, it's going to end up saving your dog's life. So, wrap it up here.
Hey, thank you very much. Welcome, everybody. One thing she didn't mention is we're going to hold any questions you guys might have till the end, because we've got a lot to cover, and I don't know what the time frame is going to be, so we're going to do that. So we're going to get right to it because we have a lot to go over. First off, our learning objectives as first aid responders for our dogs in this course is to understand your role in pet first aid, what pet first aid is and is not, how to respond effectively and safely, and
transferred to the veterinarian. One of the things that first aid is, it's treatment that's rendered as soon as there's a problem or an emergency identified. It's usually performed at the accident scene or at the site of the injury, wherever that might happen. And it really is only a bridge between you and getting your animal to the veterinarian. You don't want to not take your animal to the vet because you've done first aid. This is just stopgap measures. If it's used inappropriately, it can often result in proper care never being received. If you go, oh, well, it's just this and there's no problem, it can complicate things farther on down the line. And it can delay care to such an extent as to really compound the problem. So you want to be aware of that. You're not being a vet. You're being the intermediary between being a vet, the injury and the vet. So one of the most important things when you're dealing with an emergency is to move slowly and to breathe. You guys have to keep yourself safe. If you're not safe, if you get bit by the dog or injured by the animal some way, you're not going to do any good to the injured animal. So whenever you come across an animal that is injured, your adrenaline's going to kick up just like the animal's is. I want you to take a big, deep breath and just let it out. Realize that very little has to be done immediately. Some things do, but if you're not grounded, you're not going to do the animal any good. You need to move slowly because the animal is going to be freaked out. They're going to be frightened, and they could be painful, which can result in aggression even to your dogs. But, you can do anything at home. You know how when you're hurt, you don't think real clear. The same thing goes for our animals. So you need to take proper precautions to ensure your safety. To that end, that means we need to generally muzzle the dog. Even if he's your dog and you can do anything with him, you still want to muzzle him because you don't want to be dead. The exception to that is if the animal is choking or if they happen to be one of the shorter snouted dogs like bulldogs or something of that nature. She was going to bring Axel over. Axel's going to be our demo dog, and we're going to see if he'll cooperate. If not, we'll use this wonderful soft stuffed animal here. So one of the things you always have with you in your first aid kit, and we're going to go through that later on, hi Axel, how's it going, is rolled gauze. And I have gauze that's pretty much designed specifically for that. And this is in the handouts. It's also in the PDF that's online. I have a piece that's already cut. What you do is you go ahead and you tie it out roughly in the center. And then you make another loop. Like this. Good job, Axel. Hi, sweetie. You going to help? Going to cooperate? I know this is scary. You put it over their nose. You tighten it down just so that it's firm on their nose, and then you go ahead and you tie a bow in the back. As you can see, he's able to eat. He's able to breathe. You want to make sure you don't cut off air and that type of thing. But he's not going to be able to bite you, all right? And you tie a bow in the back because then it's really easy to get off if you need to, and he's going to get it off. Please. So that's basically how you do a really quick emergency muzzle. You can use a belt. You can use a leash. You don't want to use anything that's going to cut into the muzzle. You want to be very cognizant of that. And again, you don't want to tighten it down too tight to where they cannot breathe. Thank you, Axel. We'll see you in a minute. So another thing you need to know is if you come across an animal that is injured and cannot walk, whether they're comatose or whether they've injured a limb or something, you basically need to know how to transport them safely. And one of the best ways to do that is with a towel, a blanket, a coat, anything of that nature. So we're going to presume, because the dog can't walk, that they're on their side, they're laying down. Turn you around here, fella. He doesn't have a name, so if anybody comes up with a name, I'd appreciate that. Vanilla? Vanilla, I hadn't thought of that one. And what you do is you lay the blanket, make sure you can see here. You lay the blanket or the towel behind them, like this. And just as you would imagine, in the animal's muzzle at this point, unless they're having breathing problems, is you go ahead and you scoot the front end over, supporting the head and neck to the best of your ability, and then the same with the back end, like this. And what you've done is effectively made a sling or a travel law. If there's just two of you, you can drag it. Drag with the head end up. Don't drag with the head end down. And you can drag it to the car. If there's two of you, you can both pick up a corner and carry it like a sling and put them in the car that way. You can also use a board, but if you use a board, you need to figure out how to attach the animal to the board so that when you tilt the board, the animal doesn't fall off. That doesn't help the situation at all. So that's a couple of things that you need to know how to do with almost anything. You need to keep yourself safe. You need to apply a muzzle. I know you don't want to put one on your dog, but I'm going to suggest that you practice it in your dog field tip, so they're used to it and that type of thing. Okay. So you come across an animal that's injured, you need to do a basic assessment. And that starts out with, there's 4 steps. The first one is breathing. From a safe distance, in order to keep yourself safe, you want to check the respiratory rate. You go ahead and you time about 15 seconds to count the breaths for that, and you multiply that by 4, and that'll give you roughly the respiratory rate. And the normal respiratory rate for a dog is 15 to 30 breaths a minute. For a cat, it's 20 to 30 a minute. And a very fast rate could indicate difficulty in breathing or stress, pain, that type of thing. You also want to assess the effort. How easy is it for the animal to breathe? Are they taking rapid, shallow breaths? Are they having to use their stomach muscles to move air? Is the mouth open? And if so, what color is the tongue? The gray or blue tongue can indicate lack of oxygen. And is there any excessive noise attached to the breathing? Are they making, sounds? We're not talking about normal panting. We're talking about abnormal sounds that are coming from the chest or possibly from the gut area. The next stage you check out is mucous membrane. If the breathing is not compromised, you put the muzzle on. Because remember, if the dog's having trouble breathing, you don't muzzle them. We don't want to impair that at all. And you check the mucous membrane color. And that's the gums inside the mouth. And you can do that once the muzzle is on. You just lift up the dewlap and you can see that. You can also check the eyes, around the eyes. That'll give you those mucous membranes too. Dogs with pigmented gums, it's kind of hard to tell what's going on. And you also want to avoid where there's any gingivitis when you check this. And that's where the tooth and the gum comes together, and there's often red irritation because we don't brush our dog's teeth as often as we should. So you want to check that. Stay away from those places. Dark red mucous membranes can be the stage 1 of shock or hypertension. Light pink to white mucus can mean a stage of shock or anemia. Pink is normal. Check your dog's gums when they're normal, when they're feeling good. Look at all dogs' mouths if they'll let you. Ask and be polite, but go, hey, how's it in there? What's it look like? Familiarize yourself with what is normal for dogs. Yellow can be a possible liver compromise, and as I mentioned, gray or blue can indicate lack of oxygen. You also want to check and see if the gums are moist or dry and tacky. That lets you know what the dehydration situation may be. And then there's the capillary refill time. While you're assessing that, what you need to do is take your finger, press on the gums, and then let go of it. And it should return to normal color in about 2 seconds. This is information all that your vet's going to want to know when you contact them. So it's about 2 seconds. If it's too fast or too slow, it can mean shock, anemia or internal bleeding, and like I said, avoid gingivitis. The third stage is checking the heart rate. And you can assess that by palpating the pulse of the femoral artery or directly on the chest. So the femoral artery is located inside the rear leg. You want to bring him over and we can go ahead and see if we can find it on him. It's inside the rear leg. And again, on your dog, go ahead and find it yourself so you'll know what it feels like. You're not going to put a heavy pressure on it. You're just going to use the first 2 or 3 fingers. You're going to be able to find it. Once you find it, there's no doubt about it that you found it. All right? Hey, sweetie. Can we see if we can find your artery? Hi. Okay. And it's right at the junction by the thigh bone. And maybe when we take our break, you can go ahead and Alex will let you get personal with him. Thank you, Alex. But look for it on your own dog so that you don't have to go, is that it? Is that it? Is that it? When you're in a situation. You want to note how, let's see. A normal heart rate for a dog is 60 to 160 beats a minute. And small dogs and puppies is 180 to 220, and cats is 240. So the smaller the animal, the more rapid the heart rate is. So you want to know how easy the pulse is to feel. A fast rate could indicate shock, pain, or stress. A slow heart rate could indicate a very serious level of shock. And bounding or very strong, that boom, 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 is something you want to take note of because it can be an indicator of shock as well as a really weak pulse. The next thing you want to check, if you can, is temperature. It's not necessary if the animal is in a high state of stress or it's obvious that there's another emergency you need to deal with. The only exception to that is heat stroke. So if you think you're dealing with heat stroke, you need to go ahead and get the temperature right away. This says to use a flexible rectal thermometer. I use a digital. Don't use anything that's glass or with mercury. And because you don't want that type of thing to break. It would not be fun. A normal temperature for a dog or cat is 99 to 102.5. Too high can indicate heat exhaustion or stress or an infection, and too low can indicate a very serious level of shock. You can have your vet show you how to take a temperature. I'm not going to do that to Axel. That would just irritate him, and I don't want to do that. But what you do is you go ahead and you take the thermometer, you put a little bit of petroleum jelly on it, you lift up the tail, you put the thermometer in about a ½ inch, maybe 3/4 inch. Don't get too forceful with it. And with a digital, it'll beep. With a regular readout thermometer that isn't digital, it takes about 30 seconds. So you want to find that information your vet's going to want to know. So to repeat, the basic assessment stages, while you're staying safe, while you're breathing, while you're calm, because your dog's going to pick up on your anxiety, is to check the respiratory rate and effort, then the capillary refill time and evaluate hydration, then the heart rate and the pulse strength, and the temperature. And I carry a little notebook in my first aid kit so I can write this stuff down because you won't remember. So now we're going to address some situations that you might come across. One of the first ones is shock. And shock is unto itself is not an injury or something you're going to deal with. It's often the result of an injury or trauma. And the early stages are increased heart rate, increased respiratory rate, rapid capillary refill time, red mucous membrane, and an increased pulse pressure or blood pressure. That's the early stages. The progressive stages are a rapid heart rate, weak pulses, prolonged capillary refill time, taking longer than 2 seconds to refill, pale mucous membrane, hypothermia, which is low body temperature, lethargy, and a loss of consciousness. Your dog is unconscious, shock has really set in. So heat stroke is another one, and the short-nosed breeds such as bulldogs and pugs and terriers, Boston Terriers, are especially at risk at this. We don't have a lot of hot weather in Montana, but things are changing, it seems. And July, August, and even into September and sometimes October, we've seen some, 90-plus degree days. So you need to be aware of this, I think, even more than we used to be aware of it. The symptoms are excessive panting, bright red gums and tongue. The gums are going to feel dry to the touch. Thick saliva, excessive trembling, staggering, lying down and refusing or unable to get up. These are really serious things for your dog. A rectal temperature of over 104 needs immediate veterinary attention. Over 106 is a dire emergency. Things are cooking in there. One of the things they used to tell us to do was to submerge an animal or a person even in cold water. They found that is not what you want to do. What that does is it cools the extremity, but it drives the heat into the organs that the body is so desperately trying to preserve to live. So what you do instead is, of course, you remove the dog from the hot environment. You get into some shade, that type of thing. Take a temperature if possible. You don't submerge them in cold water or ice. What you do is place cool, wet rags on the throat where the arteries are, on the inside of the thighs, and that wicks away some of that heat. You can take, when we were kids and we were hot, we used to take our wash rags that were wet and whip them in the air and then put them back on our foreheads or whatever. You can do that type of thing, so you need to replace them often. You can slightly spray them or damp them with lukewarm water and put them in front of a fan. If you're out in the woods, you can take your hat off and you can, do like that with them, or a newspaper or a magazine or something, just to get the air movement around them. Offer them cool water to drink, but don't force them to. We don't want to put them in a choking situation, because that's a whole other thing. You just offer it to them. The most effective treatment is with IV fluids and medications administered by a veterinarian. So even if you think your dog is better, go ahead and take your dog to the vet, because there may have been some internal damage to some of those organs that are, necessary for life. So heat stroke is nothing to mess with. So get your dog to a vet. So the next thing we're going to address is lacerations and wounds. I think that's right. And they can be superficial or deep, including tendons and muscles. Lacerations presented to a veterinarian within the first 12 hours can be sutured closed. After 24 hours, they usually cannot be sutured because the skin has already started to granulate down inside, so they generally don't suture them after that. And if a high amount of contamination is present, the laceration will not be closed due to the risk of infection. And we see this specifically with puncture wounds. We don't want things to heal over the top, because then you end up with a pus pocket in there and you've got infection down in there deep. So you don't want to close something up if there's a lot of contamination in it. You need to assess bleeding. Check the mucous membrane color. If the gums are pale and the dog seems weak, immediate veterinary attention is required. Respiratory rate and effort. A puncture wound to the chest can mean a collapsed lung. And if the gums appear healthy and pink color and the animal is not in respiratory distress, you clean the wound until help can be obtained. All right? So controlling blood loss. With surface wounds, you want to apply direct pressure over the wound using gauze or cloth, and that will usually stop the flow. You don't want to wipe or pat the wound, and that's something that, you always want to check and see, is it stopped, is it stopped? Well, every time you do that, you stop the clotting process. So you don't want to do that. What you do is you just put another piece of gauze on top if it's soaking through, something more on top, maintaining that direct pressure. A light bandage can be applied to keep the wound clean and dry and promote further clotting. If there's heavy bleeding, you apply immediate heavy pressure to the area to stop the flow, and that's a little bit firmer. With neck wounds, you want to be careful not to restrict the windpipe. We want our dogs to be able to breathe. If you're interested, I'm not going to go into tourniquets here. If you're interested in how to put a tourniquet on, talk to your vet. They're a great tool to know how to use, but they can also do a lot of damage, and we don't have the time to go into that right now. All right? So a wound or laceration due to a bite or other pokey object is considered contaminated. Sticks into the skin, barbed wire we run into a lot. Anything that causes a puncture, another bite by another animal, those are generally contaminated, probably not with dirt, but possibly bacteria and other sticky things that you don't want stuck in there. So for primary cleaning, you follow all the safety precautions. You muzzle the animal, even if he's your dog. Muzzle the animal. Remember, if you're bit, you can't do a thing. And the animal may require sedation for some serious things by a veterinarian. It's never a bad idea to put the hair around the affected site. And if the wound is deep or laceration, you can go ahead and use KY jelly around the wound. And we use KY jelly instead of petroleum jelly because it's water soluble. It will wash out. Petroleum jelly won't. And if you can clip fur around the wound. If not, you can use the KY jelly to go ahead around it and then kind of put the fur, use it like you use hair gel and move the fur into that. After clipping, you want to wash the wound with chlorhexidine or Benadine scrub. Benadine is something you need to dilute to where it looks like weak tea. If you put it on straight, it will burn and The dog will let you know that. So you need to dilute that to where it looks like wheat tea, and then it's thoroughly with water. And if you can, you're going to go and do that 3 times if you've got the time and you can. Something Grandma always told us was to use hydrogen peroxide on wounds. And it's really neat when it all bubbles up and you go, oh, that's cool. The trouble with hydrogen peroxide, they found, is that it not only kills the bacteria and the bad stuff in the wound, it also kills healthy cells. So you're actually doing more damage by putting hydrogen peroxide in a wound than you want to do. So don't use hydrogen peroxide in a wound. Grandma was wrong. I'm sorry. So we're going to do a quick bandaging demonstration here. And we're going to have Axel come over again. And if he doesn't want to be bandaged, we'll use this. We'll use vanilla. Is that what you said? It is his color, isn't it? That is his color. Don't use pointy scissors. My blunt ones are in my first aid kit, which we're going to get into, but we needed scissors for this. And this is also already open, just for expediency's sake. So we're going to say that Axel has injured his front leg somehow. Hi, handsome. Good boy. What are you going to do? What are you going to do? Hi, sweetie. So let's say we put the KY jelly on it. We've got the fur out of the way. We've trimmed it if we needed to and that type of thing. What we're going to do is we're going to put the gauze on the wound. We're going to take and wrap it. I wouldn't suggest you use your mouth. We're going to go ahead and wrap it. Good boy. And he can do that. And now I've contaminated the wound, as you can see. So you wrap it around. Not too tight. Good boy. And do this with your own dog. Stay doctor with your dog. And then we're going to put some vet wrap on it. One of the things that's important to remember with vet wrap is to pull it off the roll, because if you take it right off the roll, it'll tighten up. If you pull it off the roll, good boy. You wrap it around, it sticks to itself. It's wonderful, wonderful stuff. You're pink. You do. Good boy. And as I said, it sticks to itself. It's really great. If you need to keep it dry, if it's farther down on the foot, you can put it in a baggie, and you can take the baggie to them. You want them to see the colors exposed to it. Pretty simple, pretty straightforward. Thank you. No limping. A good dog. A good dog. So that's just a quick primer on how to bandage. Vet wrap is really nice. You can get it in different colors. You don't have to use pink. And make sure you pull it off the roll before you apply it, because you don't want it to tighten up. Really, really important. So fractures. The symptoms and causes, you know, anytime you see that there's abnormal form to a limb or a bone that's sticking out, you've probably got a fracture. Usually there'll be moderate to severe pain in the area, swelling, bruising, and possibly an open wound. The treatment is, the first aid guidelines is to apply the muzzle and place the animal on a blanket or a stretcher and get it to the vet as soon as possible. The more quickly it's evaluated, that increases the chance of proper treatment and healing. Luxations and dislocations. A dislocation is a joint is very difficult to differentiate between a fracture, which is why we don't splint. They decided not to splint things, because if you splint a spring or luxation, then you do more damage again to the body. So luxation or dislocation usually affects the hip, elbow, or shoulder, but any other joint can be affected. It can be fingers, it can be toes, it can be in the tail. can be any number of places. My Labrador used to come home like this after hikes to their tail. It was like, you know. So, again, you want to muzzle the dogs, place them on a blanket or a stretcher, or you can carry them if you need to, you know. Just be careful of fine injuries and stuff, and get to the vet quickly. The body attempts to heal luxations very quickly, and in just a few hours it can be impossible to reduce the dislocation. So, first aid, stabilize, get to the vet. That's what it's about. Choking. If you're really far from a vet, she wanted to know if she was really far from a vet out in the woods or something, how you would deal with that. I would go ahead and stabilize it to the best of my ability, and I actually carry newspaper to do that with, because it flexes, it gives. You're still going to need to carry them out or take them out on a stretcher. Okay? So choking. It's easily confused with reverse sneezing, vomiting, or another issue. If the animal's truly choking, they'll generally paw at their face. They'll be panicked, like you were if you're choking, and they can show signs of respiratory distress, which can be blue-tinged tongue and gum. So that's another reason you want to check the gum. If the dog is truly choking, you don't apply a muzzle. You go ahead and you remove the collar or anything restricting the throat area or the trachea, and you need to see the back of the dog's throat. And sometimes an object is visible, and sometimes it's not. Placing your hands in, disclaimer, placing your hands in a dog's mouth is a dangerous situation and you can get bit. What they recommend is that you get a pair of pliers or hemostats or tweezers and you reach in with those and get them. That said, I have put my hand down my dog's throat. But the disclaimer is, do not do that. You can get bit. If you see the obstruction, pull it out. Be careful not to push it farther and down, and if it's a sharp bone or a sharp object, be really, really careful you don't do more damage to its throat when you pull it out and tear some of the tissue. All right? You can do the Heimlich maneuver on dogs. It's not overly successful, but it gives you something to do on the way to the vet. Hopefully somebody else is driving. And you do it if you cannot see or remove the object. You need to get to the vet immediately in choking situations. And I'm going to show you how to do it on Vanilla here, but there's not a lot of weight to him, so it's going to be a little bit difficult to do. What you do is you go ahead and you put your hands like this and you do an upward thrust right at the bottom of the rib cage. So that would be generally in this area. You've got the dog up with his back end to your chest, the front end down, and you push in and up. And hopefully that will dislodge whatever is in the throat. Don't practice that on your dog. They won't appreciate that. Bloat is a really serious thing. And I don't know if any of you had a dog bloat, but it's very, very scary. It can happen just before or after heavy exercise, eating rapidly and swallowing too much air. And sometimes it just happens. And it generally happens to large-chested dogs. Boxers, Weimarimers, those types of dogs with a really large chest. The symptoms are frequent non-productive retching, lethargy, discomfort, an elevated heart rate, panting, pacing, and the stomach blows up like a balloon. Treatment. Do your best to prevent it. Sometimes it just happens, though. No first aid is available for bloat. There isn't any, I'm sorry. It requires emergency surgery and treatment. You've got to get your dog to a vet. Don't worry about calling the vet in the middle of the night if you think your dog's bloating. Better to be safe than sorry. Trust me. It's a very scary thing. Poisons or any chemicals, medicines, plants. Medicines can be over-the-counter and prescription. Insects, reptile bites, spoiled foods that can be poisonous to your animal, can cause stomach upset or anything like that. If you suspect poisoning, you want to identify what the poison is, and if it's chemical or man-made, you take the whole box. Don't just take a sample. If it's a plant or other material, you can take a sample in. You can contact your local poison control center, but have a credit card handy because they will charge you. They'll generally charge you about $65. The number for them is 888-426-4435. Put that on your refrigerator, put it in your wallet, put it in your first aid kit, put it on the back of your cell phone, put it in your cell phone. You're not thinking when things like this happen, so you need to have it accessible. In the meantime, rinse the skin. If it's not been ingested, rinse the skin, face, eyes, mouth to remove any of the substance you feel are causing localized irritation, because you don't want the dog to lick the area and ingest more of it. Speak to a veterinarian or poison control center before inducing vomiting, because a lot of poisons can do just as much damaging coming back up as they do going down. And if recommended, administer hydrogen peroxide, which this is when you do have hydrogen peroxide, orally at a dose of 1 to 3 teaspoons for every 10 minutes, 1 to 3 times until the dog vomits. So again, the Poison Control Center number is 888-426-4435. They're available 24 hours a day, 365 days a year, and do have a credit card. Insect stings and bites. That's the animal control one. Yeah. Insect bites and stings. One of the things we need to remember is honeybees are barbed stings. So that's why when a honeybee gets this and they fly away and to die, there's this little sac attached to the stinger that's still pumping venom into the body. Wasps and those types of mud daubers that we get and have been really bad the past few years, they can sting again and again and again. So you don't have a stinger with them, but you do with a honeybee. So there's pain at the site of the bite. The dog can tremble or shiver. There can be an elevated body temperature. The lips and eyes and face can swell, which is an allergic reaction. If it goes into the throat, that's anaphylactic. They have difficulty breathing, and they can go into shock. If they get into a wasp nest out in the woods and they get stung a whole bunch of times, it can be very, very serious. So if possible, you want to remove any stinger that's present with a small pair of tweezers, or I use a credit card. Tweezers work, but when you've got a honeybee sting and that those venom sacs are there pumping it in, you don't want to squeeze it. It's not a big deal, but it's just a preference. You can use tweezers, you can use a credit card. And what you do is if you've got the stinger in your arm or on the dog, you go ahead and take a credit card or something similar, and you just scrape the skin like that, the direction that the stinger went in, and that'll pop it right out. That's for honeybees. You can place ice on the site. You could administer Benadryl of 1 milligram per pound of body weight, and they'll say on the little capsule what the milligrams are in the capsule. And usually it's 25 milligrams, so a 25-pound dog would be 1 capsule. It's difficult to know if any allergic reaction will stabilize or progress to something more serious. Get to a vet. At the very least, call your vet on the phone. Say, my dog has been stung 4 times. Do I need to bring him in? At the very least. If they've been stung more than 3 or 4 times, definitely go to the vet. Dehydration is really serious for our dogs, too. It occurs as the body loses fluid and electrolytes, and a dog's body requires 1 ounce of water for every pound of body weight a day to maintain life. So if you've got a 50-pound dog, they need to drink 50 ounces of water every day just to maintain their life. That's a lot of water, which is one reason we're supposed to leave good, clean water for all our animals. Very important. Prolonged dehydration can lead to shock and death. We can live a lot longer without food than we can water. So the symptoms, lack of water or poor water intake, vomiting, diarrhea, and a fever. Dogs which are dehydrated will exhibit a loss of skin elasticity. And the way you can test that is if you go ahead on your own hand, pull it up, and when you let go, it should go back to normal quite rapidly. And you can do the same thing on your dog. But if you do it on yourself, it gives you an idea of what it's going to look like on your dog. They'll have dry lips or gum, a weak, rapid pulse. Their eyes may have sunken in somewhat, and they will be depressed. And this is farther stages. The treatment, as long as the pet's not vomiting, you can administer small amounts of water or Pedialyte orally. You can offer it to them. You can also put, like, maybe into a small syringe or a teaspoon. You can pull open their mouth and put it in the side and see if they swallow that. If they're not swallowing water, get them to the vet. The more severe the dehydration or vomiting is occurring, veterinary attention is required and other therapy may be required. They have to do IV stuff. Vomiting contributes greatly to dehydrating. A small amount of vomiting once or twice does not really constitute an emergency situation. Dogs are always eating things that make them puke. What dogs do. If you're concerned, you remove the food and water for an hour. If no vomit after an hour, you go ahead and offer a small amount of water. Offer it to them in a bowl or a plate. And then observe closely for lethargy, weakness, or fever. frequent vomiting is a concern, which is more than 3 to 5 times in a 6-hour period. It could mean an ingested toxin, a foreign body, pancreatitis, which is inflammation of the pancreas, or just in general dehydration for some reason. Diarrhea also really can contribute to dehydration, and there can be many causes of diarrhea in a dog. Again, we all know that. We've got dogs. For one occurrence, allow water but withhold food for 24 hours. A small amount of kaopectate, or it can be administered a teaspoon for every 20 pounds of body weight, 1 or 2 times, 4 to 6 hours apart. See if that helps. You can also give them a little bit of pumpkin and see if that helps. Pumpkin's really good. You want to observe for weakness or lethargy. If the diarrhea contains blood, and if the diarrhea persists for more than 24 hours, you need to get to a vet. We don't want them to go into severe dehydration, and there could be other things. Could be parasites, could be what they ate, but we want it checked out. You want to observe small, geriatric, or young dogs closely for signs of dehydration and hypoglycemia. Little animals have a harder time with it than big animals. Seizures. Seizures are really, really, really scary. The first thing I want you to remember when you're around a dog with a seizure is to take a breath. It's really important. This is one instance where you don't have to move fast. The causes can be a history of epilepsy, hypoglycemia, toxin ingestion, some other medical issue like a brain tumor or a hemorrhage, or we just don't know. And veterinarians have a really hard time figuring out what causes a lot of seizures. It takes a lot of record keeping and that type of thing. One of the things you can do is go ahead and write down the time of the seizure, when it started, last, when it occurred, at what time of the day, things of that nature. These are things that will help your vet. The types of seizures are mild or focal, which may just be fly biting, which is just snapping at the air, with no apparent reason, staring off into space, or a head nod. You may also have an old dog who's just taking a nap, so don't freak out on that. Major or grand mal, the dog will lay on their side. Their lips may be curled back, exposing teeth. They may have full-body convulsions. They may paddle uncontrollably, and they may urinate or defecate. If you witness a grand mal seizure or major seizure with your dog, then you need to make sure that the animal cannot injure themselves on any furniture, any tree limbs, any logs, any rocks, anything like that. Otherwise, you do absolutely nothing. I want you to just breathe. It scares the heck out of you. It's a terrifying thing to watch. They can't swallow their tongue, so if you try to put something in their teeth, in their mouth, you could get bitten. They're not present in their body. It's an electrical malfunction. They don't know what's going on. And don't try to restrain them. Just because it's your little fluffy dog and you just love them to death and you think you're going to hold them and keep them safe, you're actually putting them at risk and yourself at risk too. So don't try to restrain them. The best advice that I can give you is just breathe, record keep, and let it ride itself out. It's a scary thing. So one of the things I added, and Mackenzie will get this up on the website for this presentation. You guys have handouts. It dawned on me that we're at the beginning and already into tick season in this area. So I thought, well, I'll show you how to take a tick out. But I don't have any ticks attached to any of my dogs, so I didn't do that. So what I have is a little bear who's going to be our tick, and my tweezers. So the tick is attached to the dog. And what you want to do is use some fine-tip tweezers to grasp the tick as close to the skin surface as possible. Pull upward with a steady, even pressure. So you're going to go under. Don't get grossed out. Ticks are gross. I know nobody likes them. It's just the way where we live. So you go ahead, you take the tweezers, and you pull out the direction that the tick is attached with a firm, steady pressure. You don't want to twist. It's just a straight pull out. All right? You don't want to twist or anything like that, because that can cause mouth parts to come apart and be left in the body of the dog. And that's not what we want, but it's not the end of the world. If that happens, you can take your tweezers and try and pick them out. If you can't get them out, go ahead and just put some alcohol, clean the area, wash your hands, that type of thing. Keep an eye on it. What will generally happen, the body will figure out it's kind of like a sliver, and it will eventually eject those small pieces, soft pieces. If you want to, you can take the tick, you can put it in a container, you can write on a container where it was gotten, what time of the year it was, what kind of day it was, the weather conditions, and all that. You can take it to your vet, and ask them to go ahead and have some diagnostics done on it if you're concerned about diseases or something like that. It will cost you money to do that, but it's something you can do. Avoid full-floor remedies such as cleaning the tips with nail polish with petroleum jelly to suffocate them, or using heat, with a lighted match or that blown-out match thing. It doesn't work. They don't work at all. And your goal is to remove the tick as quickly as possible, not waiting for it to detach. It's a real good time again to take a breath. I know I don't. So CPR. CPR is something we all need to know for people and dogs. The order of importance in addressing CPR concerns are circulation, airway, and breathing, and you can remember that by the acronym CAB. So compression alone can be beneficial for the first 4 minutes of CPR only. Ventilation is vital after 4 minutes, and you want to perform compressions in 2-minute cycles with as few interruptions as possible. And we're going to get into that. CPR compression. It should be performed at a rate of 100 to 150 beats a minute, which is the standard Stay in the Line song by the Bee Gees. So you can sing that in your head. It'll be in your head all afternoon now. The force of compression should reach 1/3 to 1/2 the depth of the chest, and the chest should fully recoil between compressions. Compressions are recommended to be initiated first, but should not be performed longer than 4 minutes without ventilation. And there's only a 2% chance of having injury related to unnecessary chest compression. So when in doubt, start compression. And there's 4 different types of compressions we can use with our animals. The first is for very small animals, cats, tiny dogs, rats, if you're concerned about that. It's kind of hard to show you on vanilla here. So what you do is you go ahead and you take your hand like this, and you just put it on each side of the chest, and you do compressions like this. Again, staying alive, okay? That's a circumferential compression. The next kind is two-handed compression, and it's for narrow-chested dogs such as greyhounds, and it's basically the same as the other one that I'm going to show you that we use most often. But what you do is you find right where the heart is, you intertwine your hands, and you go ahead and you press down like this, using your whole body. All right? But you're doing it really much over the heart because they're narrow-chested. The one that's most commonly used is another two-handed technique. And where you do this is over the widest portion of the chest, and it's adequate for most dogs. Again, you interlock your hands, the widest point of the chest, you're going to do compression. Okay? More rapidly than you think. Sing that nasty song in your head. Okay? And the last one is if you've got a very barrel-chested dog, like English Bulldogs. And this is one that people don't think of. But because they're so barrel-chested, it's hard to get to the heart that you're after. So you put them on their back, and you do compressions this way, more like you would a human. Okay? So the airway, you've done compressions. You want to clear the airway, and I'm going to take his nose off. What you do, the dog is generally laying down. They're generally unconscious at this point, or you wouldn't be breathing and doing compressions for them. You're going to go ahead and open their mouth, just like with a human. You're going to reach in. You're going to clear out. Any debris that's in there. You don't want to force that into the lung or anything, so you're going to clear out the debris. And then you're going to start breathing for them. And in order to do that, you're going to extend the head. You're going to pull the dewlap over the bottom of the lower jaw. You're going to hold those. And then you're going to put your other hand over their nose. You don't have to do that. You can blow right into their nose. Most people want to blow into their hand. And you go ahead and you do it. And you do that, about 10 breaths a minute, or 1 every 6 seconds. And it's an inspiratory rate, I always have trouble with that word, of 1 second. So that's a puff. It's just a puff. You're not trying to blow up a big balloon. It's all right? And you should see the chest rise with each breath. So you're down like this, you're going to be able to see the chest rise. If you've got long hair, get it out of your way. So putting it all together, the CPR thing, you're going to do compressions of 100 to 150 a minute, 30 pumps to every 2 breaths, in about 2-minute cycles, and then you're going to check for vital signs. You're going to check the mucous membranes. You're going to see if you can get a pulse. You're going to look and see if you can hear any breathing sounds. And you want a full chest recoil between the pumps. So what it looks is something like this, and I apologize for my singing. Well, I'm not even going to sing. You just do 30 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 6, 7, 28, 29, 30. 2 breaths. And then we check for vital signs. If you don't have any vital signs, back again. If you've got somebody with you, they can check for vital signs as you're doing the 2 things that you're doing, the compressions and the breathing. Yeah. So triage, the assessment of injuries and this type of thing. What do you deal with first? In the order of importance, it's bleeding, only if it's from a major blood vessel. Is the heart beating, and what's the rate? Is the animal breathing? What's the rate and the effort? Are you hearing any sound? Is it bleeding from another area? And if it's minor, it's generally not life-threatening. If it's from the rectum, it's generally not life-threatening. If it's from the nose, it could be, depends on how much it is. Special considerations for bleeding. Again, areas such as the ears, nose, mouth, and feet are highly vascular and tend to bleed more. A little bit of blood looks like a lot, especially if it's in water. Take a breath. It often looks worse than it actually is. If an animal cannot bleed to death from such areas. Frank blood or bright red blood from the rectum is generally not life-threatening. Some forms of stomach upset can look and smell like death. They can have really bad breath. They can vomit. They can just be really nasty. Take your dog to the vet, but it generally isn't life-threatening. Melena or black tarry stool or dark coffee ground stool is actually more severe. That means that they're bleeding internally, and the blood is having a chance to kind of dry and dehydrate, and you get this coffee ground type looking stuff or tarry looking stool. So that is really more severe. They can vomit it up also. Okay, so first aid kits. What is in a first aid kit? Well, everything we've talked about we want in a first aid kit. This is the kit that I carry in my car or my fifth wheel or anything like that I'm going to be gone for extended time periods. If we're going out hiking for a week, I take this with me. But usually, if I'm just going out for a day hike with my dog, this is all I have to carry. It's really not much. It only weighs a couple, 3 pounds. There's not much to it at all. One of the other things I carry with me is some good pin snips or cable cutters, and the gentlemen from Footloose are going to address that. That's to get snare traps off. So I'll let them handle that. So we're going to unpack this really quick. I have a flashlight because I'm getting old and I don't really see so well anymore. So I have a flashlight. I've got a baggie that has all my bandaging equipment in it. It's got vet wrap, it's got hand sanitizer, it's got tape, it's got a couple of rolls of gauze in there. There's some more wet ones, whatever brand you want to use, it's not a problem. My blunt tip scissors. One of these portable leads. They're just little flip leads. Your vet can order them for you. They're really inexpensive. They're light. I always have them in my pocket, even when I'm just hiking for a half hour or something. You can do a lot of things with them, and I'm sure the gentlemen from Footloose are going to show you some of that, too. You can also use it as a muzzle if you need to. Here's my muzzle gauze. I've got a small garbage bag in here that I can open up and use as a ground cloth if I need to. I've got some disposable gloves. I've also got 4x6 baggies which go over most dogs' feet on the wall. Notepad and pen, because like I said, the vet's going to want the information. You're not going to remember it, trust me. In here I've got my Benadryl and aspirin. I've also got some antibiotic cream. if I need that, which I can use because I don't carry KY jelly in my small pack, but I can use it the same way. And I have Arnica montana, which is a homeopathic remedy. It's really good for sprains and aches, and you can use it as well as your dog. And here's my little baggie with tweezers, nail clippers, in case I need to go ahead and cut a toenail or something like that. And like my old credit card that's no good, so if I lose it, it doesn't matter. That's what I take out if I'm gone for, a couple hours. I'm going to be gone for a little longer, something of that nature. Just fall right in this. No big deal. I can throw it in my day pack. Not a problem. For longer time frames, when I'm going to be out camping, like I said, or backpacking for a week or something of that nature, I tend to carry more. And actually, my dogs know how to carry packs, so they carry a lot of this stuff. So they carry their own dog food, too. Gloves. More bandaging stuff. There's there's parahemostats in here. There's a Benetine wash that I mentioned that you might want to carry. You go ahead and dilute it down to where it's like tea. There's more vet wrap. There's my thermometers in here. Everything is in baggies, so I can go ahead and pull it out really rapidly. Benadine is in a baggie. The hemostat. What else we got in here? Here's my baggie with a small pair of wire cutters and a small pair of needle nose pliers, a couple of empty clean syringes, and my thermometer. Mr. Benadryl, your small garbage can of bags to use as ground cloth. A bigger container of hand wipes, some Epsom salt. If you've got a fifth-wheel or trailer, this stuff is generally already in there anyway for your own first aid. Here's my petroleum jelly, cornstarch, which you can use as styptic powder. If your dog breaks a toenail or something like that and it's bleeding a lot, you can dip it in the cornstarch. It's got zero soap in it in case I've got a dog that has a hypophosphatemia problem. This is another kind of a muzzle. You can order them online. They're made with Velcro. And one goes around the muzzle and one goes around the neck. They're attached together with elastic. They're a little awkward to use, but they can last a little better than the dog if you need that. Some bitter apple. Keep them from eating their bandages. Some saline solution to wash eyes out with. Some more hand sanitizer, hydrogen peroxide in case I need to induce vomiting. Some more leads. Leads are very valuable to have. Some more extra 4x6 baggies. Some clean cotton cloths in case I need to really pack a wound. Some more ground cloth garbage bags. A space blanket. You never know. A towel in case I need to, again, pack a wound or transport a dog. And here's the newspaper I carry so that if I need to immobilize something, I can go ahead and wrap it around like that. It's not going to cut any circulation off, but it'll help stabilize things, and you can just tape it on there with some of your first aid tape. And basically some guidelines of what we just talked about in a baggie because I don't want it to get wet. The basic first aid kit, it's not that different from what you carry for yourself. All right? A lot of information, really fast. Any questions? Porcupine quills. You need to go ahead and use your wire cutters, your small wire cutters that you have, and you pop off the end because that eliminates the vacuum that the porcupine quills cause, and then you pull them out from the inside out because the barb will cause resistance on the way back. Get it to the dog, to the vet. You've seen dogs with lots of quills. 1 or 2 quills is bad enough. Well, if you can, and that won't work. If you can lift up the do-out, you can pull it out that way. If it's in the mouth, you have to pull it out that way. You want to try to. It's just like a fish hook. You want to try to not cause more damage with that type of thing. Wire cutters are really good for fish hooks too. cut the barb off and back them out. Okay? Uh-huh. Sometimes we don't know. Often they exercise too hard and then they eat. They consume a lot of air. Bloat is a very mysterious thing. And in my longest presentation, I have a video of a dog bloating, which is really valuable to see because it's hard to describe. It looks like a lot of other things. It's scary. It's scary. Usually they have ropey liquid coming out of their mouth. They can't settle. Their stomach blows up. The longer you wait, the worse it is. Yeah. Anything else? I didn't go into snake bites with this particular presentation because it's not a big problem in this area, but we do go into it in the longer presentation. Yeah. Okay. Well, I want to thank you, everybody. It was a lot of information really fast. If you're interested in a more in-depth first aid class, it's about 3.5 to 4 hours long. You can contact myself at thejoyfulanimal.com or the people here at Dunboven, and we can set that up for you. It's PowerPoint, video, we show the vote video, and that type of thing. I thank you all for attending. I thank everybody who's online, and I hope everybody has a great weekend. And the site will get cleaned up. Thank you.